So Margie, we call you the musculoskeletal queen around the clinic here simply because of the great success you've had with things like neck pain, back pain, frozen shoulder and so on. Why is acupuncture so effective in treating these conditions, and how many treatments would you suggest for a client to feel relief?
Acupuncture and its related therapies can be very effective for helping people with acute or chronic musculoskeletal conditions, and we know this to be so because unfortunately neck and back pain and shoulder problems are a big part of daily life for so many people now, caused by overactivity or inactivity or just the way we use our bodies every day. And so my general approach in looking after people who are in pain is to start with a conversation and a consultation, try and understand why it is someone got to that place of pain. And from there, when we start the treatment, I use a combination of acupressure and gentle touch and palpation just to find where the sore places are and where the tightness is before we start a treatment. The first treatment is usually going to be quite gentle because we never want a flare up of a condition in that first treatment or two, because that can be very distressing for people. And from there we move on, and as progress unfolds we just keep moving along using many of the techniques and therapeutic actions that we've got available to us in acupuncture, which can include cupping, warming therapies, electroacupuncture, acupressure, and of course very gentle acupuncture needling. In terms of how long is it going to take till I feel better, obviously that's the biggest question everybody has, particularly when they're in pain. And it's very hard to give everyone a very definite answer because everyone's different. But the general rule of thumb amongst acupuncturists is that if someone's fairly fit and active and healthy and their painful condition started very recently, it's acute, you've never had it before, we know you're going to resolve pretty quickly, and we're generally going to suggest 2 treatments and 3 if you can manage it each week for a couple of weeks, and then review at that period of time, and then step down to fortnightly and then maybe a couple of monthly maintenance treatments just to support you through that process. People who have a chronic or recurrent condition that's troubled them for some time, and maybe they've tried a lot of other different therapies and approaches, who come to us for acupuncture, we can't say you're going to get a magical, really fast result. Unfortunately, acupuncture is not a magic bullet. We wish that it was. But again, I like to start carefully, slowly and gently, and just start understanding why you have pain, what you've been through, start giving gentle treatments, and gradually work through all the things that are contributing to your pain and your limited mobility. How does acupuncture work? We know that when we put needles into known acupuncture points that we're going to get an increase in blood supply, and the tissues are going to soften and relax, and with our other therapies are going to warm up and become a lot more comfortable and less tight and less intensely burny. Some of our treatments will help get rid of all those terrible knots that are in those big muscles in the neck. And we just proceed on working to your limits of your tolerance, working to how your response is, giving treatments that are designed to improve circulation, relax the soft tissues, and help restore your range of motion and normal function. And again, because we like to work holistically here, how you're using your body every day, and that can be work or in recreation, or if you're not working, what else you do in the course of the day, and your general response to your pain are key factors in how we help guide you through your course of treatment. And sometimes people will want to try some of our herbal anti-inflammatory and pain-relieving herbs and supplements. We can also often use the very famous well-regarded supplement, which is particularly good for tight muscles, particularly if there's a little bit of tension and anxiety in the background there. And we just proceed on bit by bit by bit and help you get where you need to be.